Namaste. I Jivin Dr. Shaima Kadri from Faculty of Physiotherapy and Diagnostics, and today in this video we are going to talk about shoe and its modification. It is the part of the bioengineering and program included PPT 7SEM. So let's begin with the footwear, which first includes shoe and boots. So footwear is the central component of the general function of foot orthosis. The parts of the footwear or shoe is upper, covers the dorsal aspect of the foot. Sole lies under the plantar surface of the foot. Heel lies under the anatomical heel and lining. Now, the boot or shoe is consists of the different parts includes counter, the posterior part, collar, lining, tongue, upper ram, toe, heel, quarter, midsole, and outsole. As you can see in our toe cap, the upper anterior section involves vam, toe box, throat, let's say with eyelet, tongue. Posterior section includes heel counter, tongue, strips of leather under laces, throat at the base of tongue. Laces contain eyelets for laces as the types of the thoughts are here, which is different. The types as the types are blucher, open lacing, wide opening, balmoral, closed lacing, narrow opening. As outer sole touches the floor, midsole in between the outer sole and inner sole is touches the foot made of the leather. Parts of the sole includes ball, widest part of the sole, base, constricted part between ball and anterior border of heel, shank, rigid piece of the material, toe break, correspond of the metatarsal head, toe spring, space between anterior portion and sole and floor. Sole material are leather, head rubber, hard rubber, crepe, which is most common, Vibram, microcellular rubbers, ethylene vinyl acetate, moldable and lightweighted. Parts of the heel include proximal and distal, heel breast, heel weight from outer sole to the tip of the heel, fitting criteria, no pain, skin problems and deformity, should be purchased at the end of the day, shouldn't fall off, length should be at least half an inch, 1.2 centimeter beyond the longest toe, free space for first and fifth metatarsal with width greatest at the broadest part of foot, fitting criteria, no gap between the medial and lateral quarters, heel quarter should close around calcaneus without bulge, give positioning effect. Height of the vein should be adequate to prevent irritation on toe. New shoes should be worn for 2 hours per day in initial days. Footwear modification, inner sole modification, heel modification, and toe box. So first, we talk about inner sole modification. Sponge inner sole, insole, metatarsal pad or bar, inner arch support, calcaneal spring, cork insole, sponge insole, excavated heel from rubber insole, heel rise, conditions, calcaneal spool, plantar fasciitis, post-calcaneal bursitis, foot ulcers. Other modifications are metatarsal bar, pes cavus, metatarsal pad, forefoot pain, calcaneal spring, calcaneal gate, cork insole for LLD, medial arch support, pes planus, metatarsal bars are used. Heel modification includes Thomas heel, crooked heel, reverse Thomas heel, flare heel, heel wedge, rocker bottom heel, heel lift, heel rise. Thomas heels are extension of medial heel, breast, maintain medial longitudinal arch. Reverse Thomas heels supports lateral longitudinal arch. Heel wedge, genu varum deformity, lateral wedge, and genu valgum deformity, medial wedge. Rocker bottom heel, facilitating plantar flexion and facilitates gait in swing phase. Benefits ankle fusion, ankle sprain, metatarsalgia. Heel rise for LLD, heel flare for mediolateral stability. Common conditions are pes planus, pronation of foot involves eversion at midfoot, modification needed, medial arch support, Thomas heel or for patient of pes planus should not be threatened by orthosis. Pes cavus, excess pressure over the heel and the metatarsal head, modification heel rise or lift. Metatarsalgia modification, a quarter inch thick metatarsal pad is applied proximal to the lateral aspect of the foot, first metatarsal head, medial of the fifth metatarsal head. Rocker bottom shoe. Heel pain modification, rubber heel pain, calcaneal bar, heel rise, rocker bottom shoe, plantar fascia, nice splint, toe pain, Hallis digitus, gout, OA, modification, full length, carbon insert, metal shank, leg length of less than half inch is acceptable. Heel pad 75% of leg length discriminancy to be concerted. Osteoarthritis knee, lateral heel wedges for medial compartment involvement. A quarter of inch thickness is used with medial tapping. So students, this is all about the shoe and its modification. Hope you understand it well. If you have any queries related this, ask me in comment section. This video is powered by 2.0 digital version of 2.0 Jyoti Vidyapeeth Women's University. खुश रहिए नमस्ते